Well, thank you so much, Ellen. Thank you, everybody. Thank you, MPHA, and all who are here with us today. My name is Jesse Stock. I work for Primary Health. We'll dive in a little bit deeper into introductions in just a minute. But first, in the way of an agenda, we're going to do intros, as I mentioned, then we'll share a little bit more about Primary Health. You may know us as Primary Bio. A lot of folks in the state of Minnesota know us by that, but we are Primary Health. We also go by Primary. And then we will dive into a demo of our platform, our community health platform. We're very excited to share that with all of you today. And then we will make sure to save some time for Q&A at the end and then talk next steps. We usually say feel free to interrupt us throughout this presentation, but we kindly ask that you just save your questions until the end during the Q&A time, but feel free to write them in the chat along the way, just so that you don't forget them or anything. So with that, then we'll talk next steps, of course. Excited to get that, to get there as well with you all today. So in terms of introductions, as I said, my name is Jesse Stock. I am a Director of Business Development with Primary Health. I've been with the team a little over a year, and my primary focus is the state of Minnesota, Colorado, Massachusetts, and other states. And my goal is to forge partnerships with entities across sectors: governmental, non-governmental, private, a nonprofit, you name it. No one is off the table in terms of who Primary will partner with. So I like to share that at the beginning as you hear what we have to share today. And then alongside me today, I would like to introduce Jackie Martinez. Jackie is our head of product. She will be guiding the demo today. Very excited to have her on the call. Welcome to the call, Jackie. And with that, we'd love to share a little bit more about us. I'd like to start with our mission first, which is, and I will read it: to end the spread of airborne diseases and reduce the severity of all diseases by providing simple, affordable diagnostics at preventative care at scale. Now, before we get into what we do, I'd like to talk a little bit more about our history, where we came from, what is driving us. So we actually were born out of the pandemic. We started as a volunteer organization that was tasked with testing an entire community in a small town of California. We did so successfully, and word kind of spread like wildfire. You see the clipping from CNN here on the left side of your screen. Shortly after that, we launched our for-profit entity, and then we started responding to COVID alongside public health entities and partners across the country. We are very proud that the first statewide contract that we landed was with the state of Minnesota, specifically the Minnesota Department of Health. And we started setting up pop-up testing operations in response to the social gathering that was taking place during widespread protesting and civil unrest as a result of the tragic murder of George Floyd. So we were setting up in community centers, places of worship, trusted community settings to make sure that folks who were out getting their voice heard had an opportunity to get tested during the height of this pandemic that we still were learning so much about. So that's just one example of our work in the state of Minnesota. You may have used our platform to schedule a vaccination opportunity or a testing opportunity throughout the COVID pandemic response. We've done mobile units in Minnesota alongside our community providers. We've done semi-permanent sites alongside our community partners, and we've done very targeted outreach-oriented vaccination in the community alongside our partners at the state, our community provider partners, and our great CCCs, our COVID community coordinators across the state. Shout out to our CCCs. We're very grateful for your partnership and are proud to be able to continue to do that work with you today. So fast forward to today, We are in 25 states now and counting. We were born out of the pandemic, and we continue to serve in COVID. So we are not expanding beyond COVID because we know there are still a lot of communities that are disproportionately being impacted by COVID-19. We are, in addition to our COVID work, are expanding in addition to COVID-19 into other communicable and infectious disease spaces, including flu testing and vaccination, well child vaccination, monkeypox vaccination, and STI and HIV response work as well. We're very proud to have recently, alongside a CBO partner in the States, have launched our first implementation of a chlamydia and gonorrhea testing opportunity in the metro. So we're excited about that and what the future has in store for Primary Health and our partners in Minnesota. So fast forward to today, just by the numbers, we've served in over 10,000 locations across the country, 1.5 million vaccines delivered across the country, 13 million tests delivered across the country, and over 7 million individual lives served across the country. Of note, we're also in over 4,000 schools across the country. We have a very important partnership with the California Department of Public Health, where we have been providing testing across public schools in California, and we've done a lot of work in partnership with schools as well in the state of Minnesota in terms of school-age children vaccination, et cetera. So now a little bit about, okay, those are kind of the numbers to date, but what does Primary Health do? We do a lot, so I'll try and keep it brief here because I want to make sure I provide enough time for Jackie to deliver the demo. But in a nutshell, we partner to elevate outcomes, and we empower our partners to take their care and their services to the next level. So without our partners, we would not be able to have an impact. Our partners are critical to our impact together with them. So in terms of our services, the meat and potatoes, if you will, of our services, at the core, at the heart of it, is our community health platform. Like I said, you may have used it for COVID testing or vaccination opportunities across the state of Minnesota, but it is a web-based digital software that powers the full patient experience of a testing or vaccination event, from planning and outreach to reporting and compliance and everything in between, including scheduling, registration, information gathering, social determinants of health questionnaires, communications about your appointment and other changes due to weather or things outside of our control. And those communications are via text and email. And then we empower our provider partners on the ground to deliver shots in arms and administer tests as well as do electronic prescribing on site or electronic prescribing and delivery at a local pharmacy of choice. And then, after the on-site visit is complete, we do, for any lab-based tests, we send out the results to the patient. And then on the back end, we do a lot of data and analytics work. We're able to help our partners see whether they're making progress on their goals, tell the story of the programs that they have put in place, of the successes, of the areas that remain for growth, and that those stories can help make the case for grants in the future, make the case to public health officials about what sorts of strategies and programs should be put forth in the future. So we're very proud of our platform and the work that it has been empowering across the state of Minnesota already. It's got a lot of different features. I just covered the core of them briefly, but we're happy to have answer any questions at the end or have breakout conversations following this to really dive deep into the platform. And of course, we have Jackie, who will be demoing the community health platform as well. In addition to the platform, we manage fulfillment. So we have a lot of different partnerships in terms of test supply and procurement, as well as other supplies that are needed at community health events and clinics. We empower outreach with our platform. We're going to dive into that in a separate slide shortly here. But basically, we empower CHWs, CBOs, outreach workers to go out, raise awareness, schedule appointments on the ground, answer questions, collect data and information, and we lean and work closely with our partners in terms of the cultural sensitivities, the messages that work, the audience that we need to help reach, etc. And then we have a call center and email support service as well, because we understand that as a health tech company, there are folks who lack access to the internet or an internet enabled device. So we want to make sure to break down as many barriers as we possibly can to access. And one of the ways we do that is through our call center. So anyone who can access a telephone can call and schedule appointments, and then the email and support for that back and forth if there are questions of our programming. We do empower a lot of community provider partners that we are proud of our partnerships with in Minnesota, but we also offer telehealth capabilities in terms of virtual consults, electronic prescribing, referrals, resource navigation, teleprep, etc. So very proud to have recently launched that. That's a newer service of ours. And then I mentioned the data and analytics and reporting on the back end. We also help our partners meet compliance and regulatory and grant and contract requirements. So we handle all that reporting to the state or whatever agency that may be. And then one of the big things that sets us apart from other health tech or healthcare technology companies is our program management team. So we don't just provide the software, train you up and say, okay, good luck now. We're there with you every step of the way, depending on the program design. We can be as hands-off or hands-on as you would like, but we have managed in high demand environments during the COVID response, everything from program design, implementation planning, launch, ongoing management during operations. And then, as we've seen during the COVID pandemic, we've also helped manage sunsetting of sites and locations, et cetera. So just moving right on to our program. So those are our services, but what do they culminate to do? And there are really two core programs that our services power. And on one hand, it's community clinics, which is bringing care or services to the community in the way that we have done alongside our community providers, the state of Minnesota, other partners, CBOs, CCCs in the state of Minnesota and across the country, and then self-administered testing, including at-home testing, but not limited to at-home testing. I'll get to that in just a minute. So community clinics, we can power vaccination testing. There's no appointment necessary. We set aside specific doses or tests to account for folks who do not have the access to create an appointment, whether it's over the phone or via the internet. We have powered pop-up and mobile vaccination and testing sites. We have powered walk-up and drive-through testing sites, temporary sites, one-day sites, three-day sites, semi-permanent sites that are 7 days a week, 5 days a week for however many months, permanent sites, and then also school-based sites. So, and other sites, whether they're trusted community locations, community centers, places of work, places of worship, places that groups tend to gather, wherever might be the best place to deliver a service to folks that might not otherwise access it. We can get creative and have, and we'll continue to with our partners. And then in terms of the self-administering testing side of things, we have partnered with entities to deliver at-home tests on the ground in the community, but not at a stationary clinic, if you will, like our community clinic settings, but actually like via outreach, door to door, at events that might not be necessarily testing events. So canvassing style, if you will, event-based, but not events that are specific to community clinics, and then location-based. So that empowers outreach workers, outreach staffers, CHWs, CBOs, other partners on the ground, in the field, doing the hard work of the boots on the ground to hand out tests that are then have a QR code that folks can scan with their telephone, bring the test wherever they feel comfortable carrying out the test, whether it's a COVID test, HIV test, chlamydia, gonorrhea test, syphilis test, you name it. Take the test and then be able to send that into the lab if necessary, or receive the results if it's a rapid test at home, and then log those results on the Primary platform. So then we can share that data with our partners, with public health entities, et cetera, to show our progress and to show where there might still be gaps that we need to fill. These can be rapid and lab-based tests, school-based and beyond, like I mentioned earlier. It could be straight to your home. So these tests don't have to be distributed on the ground. For folks, we know there are a lot of communities with a lot of sensitivities and stigmas around certain types of testing, especially STI and HIV testing. So we allow for at-home delivery that can either go to someone's home or where somebody wants the test to go, so that it is they receive it where they feel most comfortable. And then a new addition to our lineup is vending machines. So we have the ability to empower vending machines at a ideal location to deliver those tests to folks in need. So I want to make sure we get to Jackie's demo. So I'm just going to say on this slide, we are test and vaccine agnostic. We power any immunization and any test. You see lists of them here: well child, flu, monkeypox, COVID, sexual health testing, et cetera. We can power it through our platform and our services, and we have. So just a quick note on how we empower partnerships through our outreach empowerment components. We see these as really the thing that helps us elevate the outcomes, that takes the services that we partner with to the next level, because we're reaching folks that are hard to reach, and without the partnerships first and then the tools on the ground to get the job done, they may not be reached. So that's twofold: canvassing and communications. In terms of canvassing, like I mentioned before, we can power grassroots data collection on the ground via our ability to create custom intake forms. They can collect, they're entirely customizable, so they can collect any information. Here is just a list of some of the data sets we've collected in partnership with various entities across the country: vaccine insurance status, social determinants of health, demographics, Medicaid enrollment information we can collect, you name it, we can customize it. We can empower our outreach partners to actually schedule appointments on the ground on behalf of individuals. So for individuals who might not be tech savvy, they don't necessarily have to ever interact with our platform because of our outreach partnerships that allow them to have an appointment scheduled and then share the information of the appointment, so that individual knows, okay, I'm supposed to be here at this time, at this date, and I have a vaccine or a test secured and locked in for me. And then, of course, resource navigation, which our CBO partners and CCC partners have been doing incredible work on the ground, and we can help with that. And then in terms of communication, I'll cover it briefly because I've shared a little bit about it already. SMS and email communications, those are entirely customizable and they can be written in any language. I should have also mentioned already, our platform is translated into over 20 languages and counting. I believe it's 22 now. We're very proud of that, and we are entirely ADA accessible, and we offer a free web-based application to help folks with disabilities to still use our web-based interface, which we're very proud of. Again, we have the call center that offers live English and Spanish speaking individuals. We also use the language line, both on site and via the call center for any other languages. And the call center can do outbound or inbound. They can call targeted lists to try and get out the word about opportunities, or they can take calls with questions about appointments, rescheduling, etc. And then in terms of landline support, again, if someone has access to a landline, telephone, or a cell phone, they can call in, register, get scheduled for our opportunities. I mentioned the inbound and outbound workflows. And these are just kind of the core of our outreach empowerment, but we're growing these every day. Our platform is fully in-house, so we get very creative with our partners to create the workflows and models that make the most sense for the population ultimately that we're hoping to make a difference in together. So this, I'm just going to give a quick overview because Jackie is actually going to demo this workflow, but this is an example of our community clinic workflow in terms of a back-to-school vaccine pop-up clinic. So first, it's kickoff. We help upload the student roster information from schools and send out invites to families. Our platform powers the registration, so students and via their parents and guardians register for their vaccination, either online or in person at the time of the event, etc. And then vaccines are administered by our provider partners on the ground. And then participants receive their records digitally and via paper. And then we handle the reporting on the back end as well. This is just one example of what a community clinic can look like and what we're going to demo today for you. And then on the self-administered testing front, we just wanted to cover, before Jackie dives in, the test kit handout at an event. So actually hand-to-hand distribution of test kits that folks can then either take at the event or take home and take at home, or take to a place they feel comfortable and take there, and then either get the results immediately because it's a rapid test, or send their results to a lab via a prepaid return label, and then we would send them their results via our platform capabilities. So again, kickoff, we partner, like I said, with CBOs, folks who know their communities best, to design the programs that make the most sense. So we say, this is where we want to target the individuals that we're hoping to serve, the focus communities. And then if we can go either one of two ways. We can go the online route where folks can order tests online, or the test can be handed out at an event. So at the event, the CBO partners hand out the tests, and then the collection takes place where the individual actually takes the test. Again, they either have those results immediately or they send them to the lab via the prepaid return label. And then if, depending on their resulting, telemedicine is required or advantageous, we can power that on the back end as well. So with that, quick note on our IT security, we have the highest standard of health IT technology certification in the states of America. So very proud of that. And with that, Jackie, I tried to keep this under 30 minutes, so I got it up. I'm giving you 2 extra minutes, so I'll turn it over to you. Thank you so much, everyone, for your time, and take it away.
Thank you. Yeah, thanks everyone for joining. Thanks, Jesse, for the introduction. I just wanted to call out, there was a couple questions in the chat. Please keep the questions coming. Either Jesse or I will try to answer those, or we'll get to them at the end. but I responded to a couple, and if you have follow-ups on that, I'm happy to talk after. All right, let's see if I can share my screen here. Okay, so I'm going to start going through those two workflows that Jesse talked about. So like you said, we are test and lab agnostic, but we kind of wanted to ground this webinar in a couple of specific examples. So the first one will be, you're trying to set up we said back to school for this one, but it could be any type of, community vaccination clinic that you're trying to set up. So one really common way that starts is here, and can you all see my screen? Great. And so we give the ability just kind of out of the box to make printed materials, right? We know that that's a place where a lot of folks start. In this case, we have like a very generic logo up here, but it can be your partner's logo or your logo so that it's something familiar for folks. And then a really easy way for people to just kind of point and click to register. And then if you want to support that in more languages, maybe I'll add Somali here. I can see the preview come up, and then I can go ahead and print all of those out and post them all over the community, distribute over listservs. And the other option is to do an import and then a message out. So if I've already imported a couple, and like Jesse said, we're happy to help folks import their lists of participants, either when it's a school, usually it's students and parents and maybe even staff. When it's a community, maybe it's a CBO's listserv. And then from here, I can message out, and we can support templates in multiple languages. So here you'll see the kind of email preview that's already personalized and text preview. And this template we have set up in multiple languages already. So English, Spanish. I believe this template we have maybe also in Somali and Amharic. So we can support these templates for you so that it's really easy to do kind of this flow of, import the new list of folks that you want to do outreach to, message out to them, and then kind of kick them off with this registration process to see if they're interested in these services that you're offering to them. So then on the participant side, we have a really simple registration form, and a lot of the components of these are kind of, take what you want from it. And a lot of the text is all customizable. So here, we just are saying demo provider group. We see the 2 locations. As this person continues through, we only collect the information. You can kind of turn on and off the fields that you want to collect. So I'll use Jesse and put in a date of birth here. And everything, as much as we can, autofills, and we support landlines for, reminders via robocall. If you want to collect both phone and email, you can make both those required. You can make just one of them. You have to put in one to continue, kind of up to you there. And then same thing for this demographic information. All of this can show up or not show up, depending on what the requirements you have for your community is. And you can make them required or not required, even if they're shown. I loaded up a standard social determinants of health screener. We find it's pretty common that our community partners want to ask these types of questions. But of course, if you have other questions that are relevant to your community, you're welcome to add those as part of your registration workflow, or not even have any of this. And so we try to make it as easy as possible for you to say, oh, show this to folks when they're registering, or only show it to me when they actually show up on site. And I'm happy, the administrator, the public health nurse, I'm happy to go through these questions with them. So kind of up to you what you want to do for folks there. And again, I didn't make any of these required so that I could just kind of keep going through the demo. The consent, generally, most of our community partners have a standard consent that covers most of the services they're going to provide. Though if you do have kind of other services that require additional consent, we can support like one standard consent for your event, and then an additional consent if you have a specialty service you want to offer to that patient. And then for this demo, I only loaded up a kind of a walk-up, 2 walk-up sites, but we can support full appointment scheduling and booking. You set up your slots, you set up your opening hours. I can see 2 people every 15 minutes, or I can see 10 people an hour. And that can be supported here when the person signs up. Just finishing up here. If you want the person to select the services they'd like, if you're offering multiple, they can do that here. If that particular service has, additional screening questions, that'll show up. Again, these are, you can turn on or off whether or not these show up at all for the participant. If you feel like they're maybe a little too clinical, you can save that so it only shows up when they actually arrive on site. Our insurance questionnaire is very helpful for collecting whatever information the person can provide. So if you can have it show up that they must provide their insurance information. If they do, it gives them a little drop down. And if their insurance company is not there, they can enter it themselves. And then we have them upload a photo of the front and back of their card if they've had it. But there's an option to continue through with no identification if you want to allow that. So that the person can always kind of go through the registration, given the constraints that the clinic is operating under for insurance reimbursement. So now this person is all registered. If I go through kind of on the administrator side, now hopping into the boots of the administrator, let me close out here. I'll refresh this page. I should see Jesse pop up here. Oh, there's Jesse. Then I can go through and kind of administer the clinic workflow. So here I have my walk-up set up. I can just see everyone who's registered, and then I can see my appointment archive, folks that I've seen in the past. So let's go through for Natalie. If I need to change the clinic for whatever reason, I can do that here. Otherwise, it'll default to the clinic that this person registered with. Here it'll tell me this person's missing their insurance information. I have the option to add that myself as an administrator here when they show up on site, or I can continue on. I can view their consent. I can review all of the responses that they did to the appointment questionnaire and change any if I need to, or I can just go ahead and collapse that. For the immunization history, we are connected up to MIC. So if you have a MIC code, you can query right here during the appointment, or have those queries preloaded for that immunization history. The brief history will be whatever is relevant to the vaccines they selected or that are available at your clinic. The detailed will be everything that we got back from MIC, so you can see that. And then you'll come to the adding of the services. So let's say this person will see the vaccines that you have on site that this person is eligible or not eligible for, purely based on the age requirements. So we know that a lot goes into the clinical consideration of, is this person eligible for this vaccine? But at least we try to just make the age requirements very clear here. So if this person is getting an HPV vaccine, we'll see the additional screening questions that the staff member will need to confirm the lot. So those get added into the platform at the beginning of the day as part of the start of day workflow. If there are multiple lots, they'll be able to choose the lots that are active for that day, or just scan the barcode on the box itself. They'll go through the rest of the administration details. They'll need to put in their full name, degree once a day, and then they'll need to initial every time they administer a vaccine. And so now I tried to log the administration, but it said you didn't actually log the site. So I'll go through and fix that. And now I can print the vaccination cards. So that's kind of all the way through one single vaccination, all the way from, outreach to the registration. Like Jesse was saying, that registration can be filled out by a registrar. We can log verbal consents. We can make people, have people go through without the consent, and then upload it just with a photo when they come on site. So we can support paper workflows as well. And then, when it comes time to actually record the administration, you just snap a photo and now it's a digital record. So actually, this is the lot. So that's all I wanted to say, I think, about the vaccine workflow. And now I'm just going to jump into the other workflow that Jesse was talking about that a lot of our community health partners are excited about, which is the ability to do self-administered testing. So, through this checkout process, I maybe would have added as well if I wanted to do diabetes screening for this person. And I would just go ahead and add that service and go through and log the results through our lab manager at the end. But if I wanted to instead hand this person a kit because I'm trying to get more syphilis testing, gonorrhea testing out into the community, or UTI, we have these boxes that come kind of pre-labeled with a QR code. And we don't need to know anything about this person when you hand them the kit. All you need to do is hand them the kit. They can actually go through this full process non-digitally, but we find that most of our partners do want to have some sort of, we know who we handed this kit out to, just so they can track their program progress. So once they get the kit, there's QR code on there that they can scan. There's also many instructions inside the box that tell them, please scan this barcode to start. And as they, let me do that. After they enter the barcode, so they all have this little format here. We ask them for their contact information so that we can see, have we seen them before? And we ask them to just identify where they actually picked up this kit, or who distributed it to them. And then they go through a very similar registration process if they haven't already done this, right? So if we found them already with their contact information, then we don't ask them to refill out this information. At the most, they would need to fill out a new consent. If they don't have an address, or if they decline to provide an address, we can have them authorize their provider to receive the results, and the address associated with them will be the address of the organization that actually gave them the kit. We found it's quite helpful for some of people who are experiencing unstable housing or homelessness. They put in their contact info again if we haven't already gotten that, and then they can elect to receive their results in a number of ways. We'll verify the contact information that they gave us if they want to receive their results via phone or email, just so we make sure we're sending the right result to the right person. They don't need to do that if they're having the provider get that result. And then this is where I was saying, there's this provide consent on behalf of, where we can record the registrar details if some community health worker is helping them go through this process. Again, whatever information is required, they'll have to fill out here. Anything that you want to ask or be optional is also available here. So now they've registered. We ask them, are they ready to begin their sample collection? Depending on the type of test, sometimes, a person thinks that they're ready, but they are actually not ready because they did urinate in the last hour, or they don't have access to a private place. And we know what tests we need to prepare them for, because that's all encoded in that little QR code at the start of the box. So we already know what tests that we need to kind of prepare the user for by the time they reach this page. And we'll say, you've scanned this box. It includes these things. These are the kit contents. They make sure everything's there. And then as I go through this, just know that all of these instructions are also printed in the box. So if the person doesn't want to go through the digital instructions, they're welcome to just kind of skip the instructions and go to the next test. So this particular test kit has 3 different tests or kind of samples associated with it. So we're on to 3 of 3. This one's a rectal swab. Once they're finished, we give them a little packaging checklist, a couple things they need to write on the specimen, and then we'll say, all right, you're ready to ship. And this is where, if maybe you gave them 2 boxes, then they would go click here to register another test. On the other side of this flow, a result is being received. So this is, this person actually had 2 different boxes in this little demo for this syphilis test. They can see these results and then have a kind of custom letter from the provider. And then here, if you'd like to have an option for them to seek a telehealth appointment from here, we can connect them directly to a provider from this page. And of course, with any of these protocols, generally the positives have already been notified via phone from the requisitioning physician for this test. I'll stop there, I think, for the kit flow, and just kind of move on a little bit to just an example of some of the data and reporting we can generate from all of these workflows. So I pulled a little sample from some work we've done with MDH in the past. So this is like just kind of a sampling of dates I think most of these are from 2022, though we've continued the work through this year, seeing by zip code, which zip codes have the highest density of vaccines, across which manufacturers, which locations, and what doses are we delivering to folks. Quickly get the demographic snapshots with many filters available to you on how you want to kind of slice and dice that information. And then, of course, given the questions that you're asking, those are downloadable, exportable to whatever analysis tools you'd like to use, or we can show them in dashboards for your organization here. Okay, I think I'm going to stop there. We have 15 minutes to go. I know we wanted to leave some time for questions. Jesse, before I stop, is there anything else you wanted me to jump into here?
No, I don't believe so. Thank you so much, Jackie. That was a great overview of the types of workflows that our platform can power. I will just share my screen back very quickly, and then yes, let's open it up for questions. I know we had a couple of questions in the chat already, and thank you, Jackie, for answering them right away. But I can open it up right now for questions, and then if there are not many, I can go over the answers to the questions that we got in the chat. Any questions from folks? Okay, we have one question from Ellen Solares. What has been the biggest challenge? Ellen, not to throw it back at you, but in terms of just generally, or in terms of making a difference in communities, do you have a thought in mind?
I think just getting this all like put together and up and running.
Yeah. Okay, no, that's a great question. I think the biggest challenge that we have been experiencing lately has been kind of the hesitancy to adopt such a paradigm shifting concept of what community health could be. During the COVID pandemic, we showed what the platform can do when partnered with the right partners and when backed by significant levels of funding and the difference that can be made. But we've felt the appetite for that type of statewide community response in other areas beyond COVID-19 has been less quick for adoption than we had hoped, following the significant differences that we've made and continue to make. So the paradigm shift that is needed to close the very real gaps in well child vaccinations, the indigenous people's vaccination gaps, the paradigm shift that's required kind of in the shared headspace, if you will, from our public health leaders at the top of the state all the way down. That's been a challenge, but also funding has been a challenge as well. Just trying to identify the right funding for the right partnership that makes sense. So, we've seen the state make some great strides in terms of a recent RFP aimed at closing the child immunization gap. So that we think that's very promising, and we're excited about that. And we think that there's a lot more to be done altogether as well. Jackie, go ahead.
Yeah, I think just the other maybe call out for the attendees here is I think the other challenge has been one thing that made the COVID response like I hesitate to say straightforward, because I know that it we had to overcome lots of barriers, was that it was really clear like who was going to fund these community partnerships. And now I think moving into this next phase, it's really like, how do you use some of these tools to make it clear how like payers that you have good relationship with in your jurisdictions can contribute, and how they can kind of see impact with their member population. So if anyone is kind of looking for like, how do we operate in this, like between public health and insurers kind of gap, I think that's a place where we're really looking to help make a difference, at least on the platform side and on the capability side. There's a lot of the work that our provider partners and community health partners do every day, like really is kind of encompassed in this community health benefit. And we're happy to help operationalize where it's useful.
Yeah, it's a great point. Thank you, Jackie. Thank you for the question, Ellen. Right, we have another question from Ellen. On the flip side, what is the greatest opportunity to make a difference? I think personally, just from the data that we're seeing out of the state, the opportunity to take the model that we operationalized during COVID response and apply it to well child vaccinations to close the well child vaccination gaps that have been widened because of the COVID-19 pandemic, but that also existed pre-COVID-19 pandemic. I think we have the tools in place. We have the partnerships in place. We've done it already in schools and outside of schools for COVID vaccinations. Now it's just a matter of taking that next step to the paradigm shift of we should apply what we did in COVID to close these well child gaps so that our kids can be safe and healthy in schools. So that's what I see. Jackie, any additional thoughts on that?
No, I mean, I think, yeah, just, I think my biggest lesson learned was like our hospital system is really good at, triaging people once they have like come to the hospital. But our community partners who do outreach for all different kinds of services have spent like, the last 100 years trying to figure out how to activate their communities already to participate. And so I think the biggest opportunity is how do we leverage those kind of trusted voices in the community to also be bringing forward either, directly through, handing out test kits, or even indirectly by kind of walking hand in hand with provider partners into the trusted spaces. So how do we leverage all of that trust that's already been built?
Mm-hmm. Yeah, great point. Any other questions, whether in the chat or verbally? We welcome your questions, and we also welcome them after this call. I'll be sharing my my email address shortly. So we hope and look forward to follow-up conversations. So any other questions, thoughts, comments?
Yeah, I can just go through the questions in the chat as well. There was one question about opportunities for research. So kind of out of the box, we don't expect that every community clinic's product is integrated with a research project, but we do support that. That was, as Jesse kind of mentioned, kind of part of our first founding was projects with University of California, San Francisco, University of Louisville and Kentucky, and then with some MDH research projects, I think near the Tyson food plant as well. So yeah, we're familiar with those types of workflows and integrations, but each one of them seems to be a little bit different. So it'd be helpful just to talk. And then the second one was
sorry, Jackie. One more quick thing to add on that is I shared at the beginning of the webinar that we do a lot. So one thing we haven't talked about today is indoor air quality And we've done a lot of research in terms of indoor air quality management and improvement. And so if we know that a lot has been coming down from the federal government and therefore the state government related to indoor air quality as of late. So if that is a goal of any of the attendees today, we'd love to have that discussion around research associated with that. And go ahead, Jackie.
Yeah, no, that's a great point. And yeah, on the EHR side, similar, we've integrated with a number of different EHRs, and each one of them is a little bit different, but generally all of them speak like kind of the same language, HL7, FHIR, or kind of flat file exchange. And then we can also connect to health information exchanges. Each HIEs have like a little bit of a fee structure associated with them, so that can be a little different, but we're happy to talk with you, Kristen, or any other folks who want to chat about EHR capabilities there. Yeah, and sometimes it makes sense to send all this information back to the EHR. Sometimes it's, if it's kind of purely an insurance billing, we can connect directly to the, RCM partner for claim submission as well, if that's of interest.
Yeah, that's a great segue. And I don't, if there are additional questions, we'll be here till the top of the hour. So please share them in the chat or raise your hand or just go ahead and shout them out. But before we wrap up today, I just wanted to kind of go over, all right, we shared all this information with you, but what can we do next? So if you have follow-up questions, we would love to hear those. Feel free to email me. I have my email address right here on the screen, jesse.stock@primary.health. I would love to receive an email from you in my inbox. We'd love to set up meetings. If anything caught your attention, if you have questions and you want to just have a one-on-one deeper dive, or if you want a private demo to focus on something that we maybe didn't dive too deep into today, we would love to set those up and forge new partnerships. We're all about expanding our partnership bench, if you will. And then, of course, we would love to make a difference with each and every one of the MPHA members via our community clinics programming, our self-administered testing programming, our platform, and anything and everything in between. We've done a lot of a la carte services. For instance, in the state of Massachusetts, we powered a statewide call center for code response that did not utilize our platform, but allowed us to serve the community via our call center. So we're very customizable, very innovative, and look forward to follow-up conversations resulting from this. And then, yeah, following partnership, then delivering care and elevating outcomes together. That's what it's all about. So we couldn't have made a difference to date without our partnerships in Minnesota, and we look forward to continuing to invest and grow those into the future. So I'll stay on. Jackie, if you have anything else for the go of the order, I'll stay on till top of the hour in case there are any additional questions. But if not, we just want to thank you all for your time and for your questions. And we look forward to continuing the conversation.
Yeah, thank you both so much, Jesse and Jackie. It's exciting to think about these different cross-sector collaborations that we can engage in to address health equity, and that my passion for community-based chlamydia and gonorrhea screening is how I got connected with Jesse, is really thinking about how to make things that are inaccessible for a lot of reasons more accessible to people. Thank you all for joining us today. As I mentioned at the start, this recording will be on our YouTube page. We'll also send a follow-up email with the link and any resources as well. We encourage everyone, as always, if you're not a member of MPHA, to check us out on our website, mpha.net, and join and become a member. We hope to see you at future events. And the last thing I will say is we really want to encourage, cross-pollination and connections between people. So if you're on here and you have a program or collaboration, or you want to share about the work you're doing because you think the whole will benefit from that, please get in touch with us, because we're happy to host events like this with people as well. And with that, I will stop the recording and wish you all a good rest of the day.
Thank you.
Thank you.